Hello! Today we'll be discussing on the topic Obsessive-Compulsive Personality Disorders. As we already know, personality disorders are classified into three clusters, namely Cluster A, Cluster B and Cluster C. And Obsessive-Compulsive Personality Disorder comes under Cluster C personality disorders. Obsessive-Compulsive Personality Disorder. People with OCPD have preoccupation with details, orderliness and rules. They show traits of extreme perfectionism resulting in dysfunction and distress when perfection is not achieved, desire to be in control of people, tasks and situations, and inability to delegate tasks, neglect of friends and enjoyable activities because of excessive commitment to work or a project, inflexible about morality, ethics or values, and also they might be very tight or miserly and control over budgeting and spending money. Now let's check out the diagnostic criteria for OCPD. A pervasive pattern of preoccupation with orderliness, perfectionism and mental and interpersonal control at the expense of flexibility, openness and efficiency that begins by early adulthood and is indicated by 4 or more of the following. First, is preoccupied with details, rules, lists, order, organization of schedules to the extent that the major point of the activity is lost. Second, shows perfectionism that interferes with task completion. Third, is excessively devoted to work and productivity to the exclusion of leisure activities and friendships. Fourth, is overconscientious, scrupulous and inflexible about matters of morality, ethics or values. Fifth, is unable to discard worn out or worthless objects even when they have no sentimental values. Sixth, is reluctant to delegate tasks or to work with others unless they submit to exactly his or her way of doing things. Seventh, adopts a miserly spending style towards both self and others. Money is viewed as something to be hoarded for future catastrophes. And eighth, shows rigidity and stubbornness. Now let's check the link between obsessions and compulsions through the OCD cycle. OCD cycle starts with obsessions. Obsessions lead to anxiety and the anxiety turns into compulsions. And when we complete doing the compulsive acts, we get the relief. Now let's see some examples of OCD and what is not OCD. A man who washes his hands 100 times a day until they are red and raw is OCD, while a person who unfailingly washes his hands before every meal is not OCD. A woman who locks and relocks her door before going to work every day for half an hour is OCD, while a person who double checks that her apartment doors and windows are locked each night before she goes to bed is not OCD. A college student who must tap on the door frame of every classroom 14 times before entering is OCD, while a musician who practices a difficult passage over and over again until it's perfect is not OCD. A person who stores 19 years of newspapers just in case with no system of filing or retrieving is OCD, while a woman who dedicates all her spare time and money to building her record collection is not OCD. Now let's see the causal factors. Genetics may play a role because there is some evidence that OCPD runs in families. Environmental factors and influences in early childhood may also play a role. A person with OCPD may have a distant or overly controlling parents, and as a result, he or she may have felt the need to be perfect or perfectly obedient child. Alternatively, he or she may have been raised in an authoritarian society or religion that required strict adherence to a rigid set of rules. Now let's see the prevalence or the epidemiological rate for OCPD. It is one of the most prevalent personality disorders in the general population, with an estimated prevalence ranging from 2.1% to 7.9%. It is more common in men than in women. It is diagnosed most often in older children. It is frequently in first-degree biological relatives of person with the disorder than in the general population. And patients often have background characterized by harsh discipline. Talking about the treatment for OCPD, we can use psychotherapy. In psychotherapy, we can use group therapy and behavior therapy. Other than that, we can prevent the completion of their habitual behavior that raises patients' anxiety and leaves them susceptible to learning new coping strategies, which can be a very good regime for treating OCPD. Other than that, we can go with pharmacotherapy also. So this was all about OCPD, and also with this we come to an end for Cluster C personality disorders. Hope to see you soon with the next video. Till then, take care. Bye.